Welcome back, Deep Divers. Have you ever, really stopped to think about everything that happens just to swallow a bite of food? I mean, it's this incredible symphony, right? Muscles, nerves, reflexes, all working together. For most of us, it's just automatic. We don't even notice. But for millions, it's not simple at all. It can be this huge uphill battle, really complex, sometimes uncomfortable, even, well, dangerous. Okay, so let's unpack this. Today we're doing a deep dive into feeding and swallowing disorders. The medical term is dysphagia. We've got some great source material here that really breaks down who's at risk, the underlying causes. Some might surprise you. Our mission, basically to give you a quick grasp of all the different sides of these conditions and why they're such a challenge. Think of it as an aha moment for something maybe you take for granted.
Indeed. And when we talk about feeding and swallowing, it's really so much more than just getting nutrients in, although obviously that's critical. We're talking comfort, growth, development, even the social side of things, like meal times. So when this fundamental process gets disrupted, the impact is, well, it's profound. On health, on quality of life, on the whole family, really. Our sources give us this really helpful framework. They categorize the challenges into three main buckets: organic, developmental, and functional. We'll dig into each one, look at the key factors, and importantly, see how they often, connect.
Okay, let's start with organic conditions then. So these are the ones that come from a specific disease or a medical condition or maybe a physical defect in the body.
Exactly. There's a tangible physiological reason why things aren't working quite right. The body's machinery, so to speak.
Right. And you'd think maybe these are the most straightforward because there's a clear physical cause you can often pinpoint.
Well, yes and no. They might be easier to identify initially, maybe through tests. But what our sources really highlight is the complexity. Even with a clear starting point, the ripple effects through the person's system their whole life. Yeah. And it's just extensive.
Okay, here's where it gets really interesting, I think. The sources give some great examples. Let's start with neurological and neuromuscular conditions. So things like cerebral palsy or traumatic brain injury, muscular dystrophy. How do they mess with something as basic as swallowing? It's like the brain's signals are getting scrambled.
That's a good way to put it. The research points to several big factors that really break down that swallowing symphony. First off, motor movement and control. This is huge. Posture, muscle tone, they're often seriously impacted. This directly affects the coordination you need, the movements for eating, just maintaining head control, for instance. That's absolutely vital for swallowing safely.
Wow, okay. If you can't even keep your head steady, how do you manage food in your mouth?
Precisely. It undermines the whole foundation. And then there's the airway and respiration. That can be compromised too. Even the larynx, the voice box structure, including the vocal cords, that can be affected. The sources mention things like unilateral or bilateral vocal cord palsy.
So one or both vocal cords aren't moving right. That sounds like it would directly impact protecting the airway when you swallow.
Absolutely. It makes it much harder to keep food and liquid out of the lungs. And something else the research points out, which I found really eye-opening, is the persistence of primitive oral reflexes.
Primitive reflexes, like things babies have.
Exactly. Things like a phasic bite, where the jaw clamps down involuntarily, or a tongue thrust, where the tongue pushes food out instead of back.
Huh. So reflexes that are useful for an infant actually get in the way later on.
That's right. They're normal early on, but if they stick around, they really hinder efficient feeding. Makes it hard to chew properly or move food back to swallow. It's like the body's using an outdated program for eating.
That makes sense.
Yeah.
So what else?
Well, the structure and function of the lips, tongue, jaw. You might see a reduced range of motion, less varied movement, and also reduced motility, less effective movement in the pharynx, the throat area, and the esophagus. Food doesn't travel down as efficiently, maybe leaves residue behind.
Residue sounds risky,
Right.
like it could be inhaled.
It definitely increases the risk. And it's not just physical mechanics. The cognitive level plays a part too. Things like reduced awareness, or maybe the brain not quite preparing for feeding, disruptions in sensation. That all affects how someone approaches a meal.
Okay, and you mentioned medications.
Yes, we can't forget medication effects. Some meds impact posture, tone, even alertness or fatigue levels. And some cause dry mouth xerostomia, which makes swallowing much harder.
Gosh, it's such a web of issues just for neurological conditions. It
Yeah.
really turns something automatic into this huge conscious effort.
Exactly. A life-sustaining reflex becomes incredibly difficult and effortful.
Okay, let's move to the next type under organic. Structural anomalies. So these are actual physical differences in how the body's built, like cleft lip or palate or something called laryngomalacia.
Correct. And these have very direct impacts on feeding efficiency and, importantly, safety. You might see asymmetry in the mouth, maybe the lip or jaw position is altered, or a high palate with the tongue sitting off to one side.
And what does that do to eating?
Well, it can mean a reduced ability to build up pressure inside the mouth, that suction needed for drinking or moving food back, or just poor control over the food bolus itself. It can even lead to nasal regurgitation if the soft palate isn't working properly, food coming back up through the nose.
Ugh, that sounds awful. So food just can't stay put or move the right way.
Pretty much. And then there's the airway and respiration impact again. Conditions like micrognathia, that's a small jaw, or laryngomalacia, where the larynx tissue is soft and can kind of flop into the airway. These directly affect breathing.
So they might need medical help like oxygen.
Yes, sometimes oxygen, or even a tracheostomy, a breathing tube in the neck. And those interventions, while life-saving, then create their own challenges for coordinating swallowing and for oral sensation. It's a cascade.
Right. One thing leads to another.
And because of all this, non-oral feeding, like using feeding tubes, is pretty common with severe structural issues. Our sources really highlight how this can lead to aversive experiences, think repeated NGT placements, that tube through the nose. Painful, unpleasant, and critically, it means fewer opportunities to actually practice and develop oral feeding skills. Imagine if your earliest experiences with your mouth were mostly negative.
What a difficult start. Okay, the next group under organic is interesting. Cardiac defects and respiratory conditions. Things like hypoplastic left heart syndrome or chronic lung disease. Seemingly different systems, but the sources link them for feeding challenges.
Yes, the common thread here, according to the research, is increased respiratory effort and reduced endurance. Think about trying to eat while feeling constantly breathless, like you're running upstairs with every mouthful. That's the reality for some.
Wow. Labored breathing, a faster breathing rate. It just messes up the coordination needed to swallow safely between breaths.
So you can't easily breathe and eat.
Exactly, and all that extra effort just leads to fatigue. They get tired out before they can eat enough.
So they might not get enough calories.
Right. And for cardiac conditions specifically, the medical team has this really tricky balancing act. They have to watch out for cyanosis or desaturation oxygen levels dropping too low during feeding. Mealtime becomes this delicate risk-benefit calculation.
Yeah. And for the respiratory conditions.
Well, things like long-term ventilation or having a tracheostomy can disrupt sensation in the mouth and throat. It can even hinder how the larynx moves up and closes off the airway during a swallow, especially in older kids. Every bite is a challenge against fatigue and risk.
Incredibly demanding. Okay, next up, genetic and chromosomal conditions, like trisomy 21, Down syndrome, or CHARGE syndrome. What's the core issue here affecting feeding?
A really significant factor our sources point to is hypotonia, low muscle tone.
Low muscle tone. And that affects everything. Pretty much all phases of the swallow, yes. From the lips and tongue right down through the pharynx and esophagus, all the muscles involved might be weaker, less coordinated. This leads to reduced efficiency. Swallowing just isn't as effective, and it takes more effort to get the full range of motion needed.
And you mentioned residue before.
Yes, hypotonia increases the likelihood of residue being left behind after the swallow, food or liquid lingering in the throat, which, again, raises the risk of aspiration or choking. It's this pervasive weakness impacting the whole system.
Right, not just one weak link, but the whole chain is affected. Okay, last one in the organic category. Gastrointestinal and esophageal conditions, like GERD reflux or short bowel syndrome, these sound painful.
Absolutely. And pain is a huge factor here. Imagine trying to eat when every swallow hurts or causes severe discomfort. So factors to consider include disturbances of appetite and sensation. Maybe they don't show typical hunger cues or can't communicate hunger well. The impact of pain and anxiety is massive. Chronic pain, the anxiety around eating, even side effects from medication. It can totally kill appetite and willingness to even try eating.
And if they have specific dietary needs.
Right. Dietary limitations can mean fewer opportunities to explore different foods, narrowing what they'll accept even further, makes meals less appealing.
And hospital stays.
Frequent or long hospitalizations disrupt routines, disrupt normal mealtime experiences. And often the need for non-oral feeding comes with more of those negative orofacial experiences we talked about. It's this constant juggle for the medical teams and families, balancing weight gain, trying to offer oral feeding chances, managing the medical issues, and the anxiety around meals can just become overwhelming for everyone.
It sounds like a vicious cycle. Pain leads to avoiding food, which makes nutrition worse.
Exactly. It's tough.
Okay, that covers the organic causes. You can really see how one medical issue creates this cascade. Let's shift gears now to developmental etiologies. So these are disorders from an interruption or delay in normal development.
That's right. And while these can definitely overlap with organic problems, they have their own focus. It's more about how a child's overall developmental path impacts their feeding skills, even if there isn't an obvious physical defect causing it initially.
Okay. First under this heading is prematurity. The sources define preterm as before 37 weeks, with extremely preterm being less than 28 weeks. Tiny babies facing huge medical hurdles.
Huge hurdles, yes. The significant factors are vast. They often have other medical issues, lung disease, neurological problems, GI issues, cardiac problems. Comorbidities are common. But critically, what the sources really stress is their frequent exposure to negative orofacial experiences.
Like the feeding tube, suctioning.
Exactly. NGT placement, suctioning, ventilation, all these invasive things happening right when their oral system is developing. This can lead directly to oral motor problems, oral sensory issues, and just a lack of opportunity to practice oral feeding because they've been tube fed for so long.
So their earliest mouth experiences are often uncomfortable, even painful, instead of nurturing. That seems like it could really change how they perceive eating later on.
It absolutely can. The brain learns from those early inputs, and our sources make a really powerful point about the impact on parental mental health and anxiety around feeding. Parents often go through incredibly tough times in the NICU. Their hopes for breastfeeding or bottle feeding might be impossible. There's intense pressure for weight gain before discharge. This can lead to long-term anxiety for the parents. Mealtime becomes fraught with fear, guilt. It's a huge emotional burden that's often overlooked.
That's a really important point. The stress must be unimaginable. Okay, also under developmental is developmental delay. The term global developmental delay means a child hasn't hit milestones in, like, 2 or more areas. How does that link to feeding? Is it just slower physical skill development?
It's actually broader than that. The sources clearly state that delays in cognitive, social, and communication skills directly increase the risk for delays in feeding development.
Okay, so it's not just about the physical act.
No, learning to eat is complex. It involves understanding things, hunger cues, anticipating food. It involves social interaction at meal times. It involves communicating preferences, feeling full. If those broader skills are delayed, then the feeding milestones, which kind of depend on those foundational skills, often get delayed too. It's the whole learning process around food.
That makes total sense. It's about the timeline and integration of lots of different skills. Okay, our final main category, functional etiologies. These are driven by environmental, social, behavioral factors.
Precisely. This is where the interplay between the child and their environment, their experiences, really comes to the forefront. And these functional issues can exist on their own, or they can layer right on top of organic or developmental problems, making things even more complex.
Okay, so under functional, we have sensory behavioral feeding disorders. We all know kids can be picky, right? The sources mention neophobia, fear of new things, which is common and usually passes. But when does it become, a bigger deal?
It can definitely become a more chronic, persistent issue, like an avoidant restrictive food intake disorder, or ARFID. That's a condition where someone consistently avoids certain foods or food types. Maybe it's because of the sensory aspects, texture, smell, or maybe they had a bad experience like choking and now they're afraid. And this avoidance goes way beyond typical pickiness. It can seriously affect their health, their growth, even their social life.
Okay. The sources mention examples like autism spectrum disorder, which often comes with sensory sensitivities or even just high parental anxiety. What else contributes here?
Well, parental anxiety itself can be a factor. Parents might, maybe out of fear or worry, restrict the types or textures of food they offer. They might be afraid the child will choke or react badly. Then there's child anxiety. A previous choking incident, like you said, or even just repeated stressful meal times can make a child genuinely fearful of food. And you can get learned behaviors. Children might learn that refusing food gets a certain reaction, or they might just develop this heightened state of arousal, like stress, whenever mealtime comes around.
So the meal itself becomes the trigger for stress and anxiety, not nourishment.
Exactly. It becomes a cycle of avoidance and negative feelings.
Wow. Okay, and the last point under functional is interesting. Complex medical conditions acting as a functional overlay. Even if the original medical issue is treated, the experience can leave these lasting behavioral impacts.
Yes, it's about the long-term ripple effects, the psychological imprint, even after the immediate medical crisis is over. The sources point to a few things here, similar to what we discussed with prematurity. Repeated exposure to negative orofacial experiences, tubes, suctioning, can create a lasting aversion to anything near the mouth.
Even if they don't need the tubes anymore.
Right. The memory and the learned response are still there. Also, the impact of hospitalizations, frequent or long stays, disrupt routines, disrupt normal feeding development and opportunities. And crucially, the stress and anxiety around a child's serious illness can really impact the parent-child interaction around feeding. Parental confidence can take a hit, the whole dynamic can become strained. Feeding, instead of being a nurturing interaction, becomes loaded with worry.
So, okay, we've covered organic, developmental, functional. What does this all mean for you listening to this? What really stands out to me is just how interconnected everything is. It's almost never just one thing, is it?
Exactly. It's rarely one isolated issue. These factors often blend, they amplify each other. A child might be dealing with a mix of physical challenges, developmental delays, and environmental or behavioral factors all at once. And understanding these three broad categories, organic, developmental, functional, helps us appreciate that complexity. It pushes us towards a more holistic view, which is absolutely crucial for effective support and intervention. We need to look beyond just a single symptom and consider the whole child, their history, their environment, their family's experience. It's not just about fixing a mechanism, it's about helping restore that relationship with food and eating.
We've definitely peeled back a lot of layers today. From, the really intricate motor control stuff in neurological conditions right through to the huge impact of anxiety and functional disorders.
Yeah.
It's quite a journey through these challenges that so many people face, often invisibly.
It really is.
Yeah.
And given all this complexity, all the factors impacting something as basic, as fundamental as eating, what does this deep dive make you consider about the simple acts, maybe the mouthfuls you take for granted every day? And maybe more importantly, how might understanding these nuances, this interconnectedness, shift how we think about supporting people, children, adults, families who are facing these really intricate challenges?
That is definitely a powerful thought to chew on. Thank you so much for joining us for this deep dive. Until next time, keep exploring.